Scott Kilby, the Video Foot Doc, here with another video for you on all things foot and ankle. Today I'd like to give sort of a basic primer regarding the nature of foot wounds. Now this primer can also apply to wounds in other different locations, but there are some certain unique factors that go along with foot wounds, as the foot seems to be the place where ulcers and sores seem to develop the most in the body and can cause the most amount of complications. Now, wounds are essentially destruction and breakdown of the normal covering of the body, which is the skin itself. Wounds can appear for several different reasons, and I'll go over what some of those reasons are in a little bit. Essentially what happens in a wound is that the skin is basically dies. It basically is destroyed, and a cavity appears where the body was once covered with tissue. Now this cavity can be superficial in that it may only go through the partial layer of skin, or it may go all the way through the skin into the fat tissue underneath, and in some cases it can even progress down into the muscle and other soft tissue that's below that, and sometimes it can go all the way down to the level of bones, which are sort of the bottom layer of what a wound can progress to. Now, wounds in the body, in particular wounds in the foot, basically come about through a number of different reasons. Wounds can develop because of poor circulation, in which the skin tissue actually dies because it's not getting enough nutrients. They can develop because there's too much pressure on the skin itself, and a lot of times this goes along with having poor sensation, so that someone doesn't necessarily feel this excessive continuous pressure on the skin, and essentially the skin can't take that pressure for long and it'll eventually start to die with a crater forming underneath that area. Wounds can also form essentially because of swelling or disease of the veins of the leg, which can cause erosions in the skin to develop. And wounds obviously can be caused because of injury or trauma, in which something actually removes part of the skin, or the skin is punctured into because of something sticking into it. Diabetics have unique problems with wounds, in that diabetics will have wounds that can be a combination of sort of a lot of different factors, which can include having poor sensation and too much pressure, as well as also having poor circulation. Wounds themselves are unique, and each one has a sort of a different cause that needs to be addressed in order for the wound to heal. Now, in the last 30 years or so, we've come a long way in developing technologies, including wound dressings and other techniques of trying to heal wounds themselves. And this also includes tissue grafts and other surgical techniques, which are essentially designed to restore the skin surface over the wound itself. With every individual wound, the actual cause of it must be addressed. Pressure must be reduced in wounds that are due to pressure. Circulation must be restored in wounds that are due to poor circulation, and on, especially with things like wounds due to vein damage or vein swelling. The swelling must be controlled in order for the wounds to be able to be properly healed. Wound care is fairly complicated, but at the same time it's also fairly simple. The wound itself needs to stay moist, and appropriate amount of drainage needs to be removed from the wound in order for the wound to heal properly. There are numerous different dressings and different types of chemicals and other things that have been created to address all these different issues by keeping the wound moist, as well as getting rid of excessive drainage and excessive things that will create too much moisture that won't allow the actual skin surrounding the wound to creep over the wound surface itself appropriately. Wound care is best left performed by professionals and not necessarily at home. Because of the complexity of many different types of wounds, especially diabetic wounds, which often become infected and need antibiotic management, and a lot of times surgical management as well. So if you do develop a wound, no matter what your health status is, it's always best to have that looked at by a physician, and then proper wound care needs to be performed in order for the wound to heal properly. And this can include a wide variety of different techniques, and a lot of times wound care centers perform this, and sometimes the physician himself, especially if it's a foot wound, where a lot of times a podiatrist will perform the wound care themselves, as we typically are well trained in treating numerous different varieties of foot and ankle wounds. So don't go it alone. If you do develop a wound for whatever reason, it needs to be professionally cared for because the consequences of the wound not healing can sometimes be fairly devastating, and this is especially true if you're diabetic. Well, I hope you enjoyed watching this video. Look for more videos on all things foot and ankle on this site as well as others, or you may check out my website at www.inpodiatrygroup.com. Thank you.